Hi everyone, and welcome back to another Star Facebook Live Q&A session. And I am your host Joshua Lim, and joining me today is my colleague Tina Loh. The topic today is about COVID-19 booster shots and all the questions that come with it. Do we really need a third dose? Is it effective and safe? And can we wait? And can we mix the vaccines?
Yes, so currently in Malaysia, if you are a frontliner or a person aged 60 and above, or if you are with comorbidities, you are actually eligible to get a Pfizer booster shot. But I'm sure a lot of us have the questions that Joshua has just mentioned, not just for ourselves, but also for our family, like our parents, right? So here to answer some of the questions is Association Professor Dr. Tan To Leong, who is also an emergency physician at Hospital Canselor Tuanku Muhriz. Dr. Tan, welcome to the show.
Hello, thank you, Tina and Joshua. Good evening, everyone. Yeah.
And thank you for joining us again, Dr. Tan.
Yeah.
I know this is not our first session, and it's always good to have you and hear your perspective as not only a frontliner but also an educator as well. So let's get started with today's session. And if anyone who's watching, you guys have any questions, leave them on the comment section, and we'll try to answer them whenever we have time in this video. And we'll also allocate some time at the end of the video to answer any questions you have regarding COVID-19 booster shots. So my first question to Dr. Tan, we hear people use terms like booster shots and a third dose. Is there a difference?
Okay. Basically, the name of the booster dose and third dose, or we call it additional dose, is different terminology. However, the content is the same. The content and the strength of the dose is the same. Okay, how to differentiate booster and also third dose? Okay, booster is for those who already completed their 2 doses of vaccination. However, the protections already wane off according to time. So when especially in the Comirnaty, which is a Pfizer, they have 6 months of period of protection, but after the 6 months, the protection waning off. So we give a booster dose, so to add on the strength, improve the strength of the protection. However, for those who are third dose, or we call it the additional dose, dose is for those patients who already get the completed 2 doses of vaccine, but they didn't get the vaccine effect, and they don't have they didn't get the protection effect, so they need an additional dose to trigger again the body to get the immunization. So basically, the third dose is like a new jab, new type of again vaccination again. So for those who are special immunocompromised, means that the patient have immunity, which they have a compromise of immune system. So this type of patient, they have a different, we call it third dose or additional dose. However, both dose, the strength is the same. Just the timing is different.
Okay, so both require an additional dose, but the timing and kind of the situation, the circumstance to why the reason to why the dose is administered is different. And like you say, for immunocompromised, it's because during the first 2 doses, it's called an additional dose because they weren't able to get sufficient antibodies or sufficient immunity after the first 2 doses. That's why there's a third dose within a shorter period of time. And am I right?
Yes, correct.
Yeah. And then the booster shot is just for those who have been fully protected already. Immunity, as we have heard, wanes and it decreases. So this is an extra shot so that give you a boost up.
Yes.
Against COVID-19.
But is there like a telltale signs? How would I know if my parents or myself, if our vaccine is already waning out? I need a booster shot. Is there any sign that we can look at?
Definitely, there's no any much of sign that you can observe when your immunity is coming down. However, this is based on the statistic and the report from the journals reported that this vaccine the protection is only for 6 months. There's few publication especially in Lancet, and also New England Journal saying that Comirnaty have about six month protection rate. So that's why they follow this data, because the data got a lot. It's a big database. So definitely follow this big database. They will just tell you that the function of vaccine will win off according to the time frame that they suggest, which is 6 months. So So that's why we no need to test or check ourselves whether we have this immunity or not. Besides, there's because they already analyzed in a big group of patients, more than 1 million of people are included in the study. So definitely they have a normal graph. We will follow the same normal graph. We will behave the vaccine to our body will behave almost the same. Usually we have a bell curve. Maybe 1 or 2% of patients will have a longer effect on the protection. I mean, it's after the 2 doses, but also there is 1 or 2% of patients, maybe they have a less, which is 3 months, maybe the protection. So as a whole, as a policymaker, definitely we will make a wholesome policy and which is suit to the whole public. That's why 6 months as a cut-off point for Comirnaty. And but for others, Comirnaty is Pfizer. But for other vaccine, they is still waiting for the recommendation for according to their company recommendation. So currently, we know it's Pfizer is the one who are winning. Our time is almost there. The frontliner is February, March received their first and second dose. So now it's almost 7 months.
Okay.
That's why they started the third dose lah.
So even though Malaysia has started giving out booster shots, but it's not for everyone, right? Again, not anyone just suka can go sign up, right?
Yeah. Correct. We have a very particular about this target group because based on the database recommended by WHO and also CDC for vaccine, actually they will have this side effect of myocarditis, but it's very rare. However, because of the booster dose, if too early or too late, or too early, cause this myocarditis. But however, this won't they also found that for older population, which is 60 years old and above, the community not causing the myocarditis compared with younger, which is less than 60 years old, and especially in young and male patient. There's a paper on Israel they published in New England Journal saying that those who are 40 years old and below, especially some men, young, if they have the dosing is too high, meaning that repeated the dose of dose, they will have higher chance of getting this myocarditis, which is the heart inflammation, heart muscle inflammation.
Yeah, I was just about to ask a clarification on what you meant by that, the heart inflammation. So are you saying that that there is actually a lower chance, which is already a low chance, but it is a lower chance if you are the older that you are 60 and above to experience that heart inflammation if you get the vaccine?
Yes, definitely. That's why WHO already seeing look into this data. That's why 60 years old and above, there's almost none of the myocarditis. It means heart inflammation cases happen. That's why they recommend for 60 years old for the third dose, not for younger population yet, unless we are in the high risk, like as myself is a frontliner. So we need a third dose because we are high risk of getting COVID compared with the public. So the risk of getting COVID and due to COVID death is high, outweigh the risk of getting the heart inflammation, the risk of getting that. So that's why for those who are frontliner, we are exception for the age group, which is the 60 and below, but yet we will receive the third dose. For those who are public,
why is that actually? Why are frontliners? Pardon my ignorance or pardon me for asking this. Why in the groups are frontliners included as well? Because they are younger and they would have gotten 2 doses, and I think it's Pfizer as well, which has shown to have a higher efficacy. So what's can you explain the rationale there?
The rationale is that if because we are exposing ourselves every day to COVID infections, infected patients, so our risk of contracting the COVID is high, and when the risk is high, definitely there's a risk of getting severe COVID, definitely. So this risk is higher. This risk is higher than compared with after the third dose getting the heart inflammation. The risk is lower. So the benefit of getting third dose definitely outweighed of getting the COVID infection on ourselves. Understand? So if you get the third dose for a frontliner, you protect the frontliner. from preventing them from COVID death, definitely the benefit is better if compared with taking the risk of getting the myocarditis, which is actually is 8 over 10,000, 100,000, sorry, 8 over 100,000. For COVID, that is about 5%. It's every 5%, every 100 patient, 5 will die on COVID. You see? So the risk of getting COVID itself is higher for us if we don't have the third dose, and due to that and pass away, compared with those who get injection and get the myocarditis, which is the heart inflammation, which is the risk is lower. So that's why the benefit outweigh the risk. So that's why the frontliner need to get the third dose. But in the public, it's different. Public, because they don't deal with patient, they and also they have a safety margin which is 60 years old and above. So the risk of getting myocarditis or the heart inflammation is so low until near zero, which getting the third dose will help them prevent from COVID death. Definitely is a benefit better. So that's why they get the third dose. But not for the public who are less than 60 years old. Because the public for 60 years old and below, after you have 2 doses of COVID vaccination, your protection is still good. Even though, but the risk of getting COVID that is so low. If you get the third dose, then we have to consider whether we have to, balance up the risk of heart inflammation in the younger population. So that's why there's more vaccine.
So everything's just a weighing between whether the benefits of getting a third or additional dose outweighs the risk. It's not so much that getting a third dose is all good and dandy. It's always like even the start of the vaccine, a balance between what are the pros and cons, whether the pros of this outweigh the risks that are involved with no protection at all from COVID-19.
Correct. We always use the risk and benefit. Yeah.
There's so much that even with booster doses as well. There's so much that we have to unpack, that we want to unpack here. So many things that we had to ask. But I'm seeing some interesting questions from the comment section, and I guess we should. I'm going to give them a chance to ask some questions as well. Mohinder Singh and Elaine Chan kind of asked the similar questions here. How about 2 doses of Sinovac, and now they will be given the Pfizer booster dose? Any problem with essentially mixing vaccines?
Yeah. Okay. This decision is a big decision. I understand the whole KKM have already they have sit together and discussed about the benefit outweigh the risk. So according to, I give you some of the some data that I know that's published in British Medical Journal, the BMJ, which is published on August. So what happened is that inside this the publication they mentioned 2 countries, which is the Turkey and also the Uruguay. Both of these countries, many of the people there received 2 doses of Sinovac, and they already completed 3 months later, and then now they're starting a booster dose, which is using the Pfizer. So they started way earlier than us, which is July and above, July and earlier. So until now, there's not much of any casualties or any side effects or any reported myocarditis death, and causing or inflammation in the heart that reported in these 2 countries.
I just want a clarification. Sorry to interrupt. When you say that line right there, I think it may cause some concern. So I think that's the clarification. Are we talking about we're not seeing many, or we're not hearing reports at all? Because it's kind of a big difference. Yeah.
Okay. Other than that, currently there's not much of reports that are reported on the third dose Pfizer on top of Sinovac. Meaning there's not a solid publication, but however there's a lot of news, which is a reliable news that and was published. All this news was published by the British Medical Journal, which is a very reputable journals that they mentioned that there's 2 countries that's doing this, and there's not much of any things that reported as an adverse effect, but we still yet to wait for the data. Okay. However, for our Malaysians until today in Sarawak, I think there is more than 8,000 of the people already received the third dose, and so far in Malaysia, there is no any case of that or any complication, as I know. So that's why in up to this date, I would say that we still need more data to support this safety. However, I can give you some of these examples to let you know that you can reach whether you want to get the third dose or not. And furthermore, our neighbor country, which is Thailand and Cambodia, those who already completed 2 doses of Sinovac, they give the booster dose of AstraZeneca. So it's already started also since a few months ago. So I still yet to wait for any reports on any side effects. But however, so far there's no any major case was reported. Because any adverse effect reported, definitely it will be a big cases. But I don't have the solid data in my hand. But this is what I know. This is what I know. That's why you need to you have to see whether this news can able to give you some of the idea about the safety of Pfizer on top of the 2 Sinovacs. Yeah,
I think our health minister also said that the ministry is still gathering data from Britain on their country's boosters dose program for the AZ recipients as well. Doctor, just now you mentioned that about this heart inflammation thingy. Eric Ng here also asked you that what would be the impact due to the heart inflammation if one is experiencing one?
And is it something that's quite permanent or reversible?
Okay. In one of the publication about this heart inflammation due to the Pfizer, there's the Israel study. There's about 101 out of I forgot about the total subjects included. But however, out of the a big amount, I think it's about few thousand. No, sorry, I think it's millions. Sorry. So there's about 178 patients of myocarditis. All right, but only about 1 person, I think only 1 person passed away due to myocarditis, which is the heart inflammation. So you want to say it's because of that vaccine is very dangerous. I think this is the risk is lower than the accident of I say that you drive a car, you have accidents of causing death. This is almost, I think is this one is rarer. Yeah. So that's why I think that you have to see the our statistic wise, definitely everything got risk. I won't say there's no 100% no risk, but the death due to the heart inflammation is possible, but it's so rare until it's lower than the accident death. So this is what I'm trying to give you some example to understand the situation. Yeah.
Mm-hmm. For those who have just joined us, just now we mentioned that currently the booster shots will be given to these 3 categories. Number 1, if you're the frontliners. Number 2, if you are age 60 and above. And then number 3, if you have comorbidities, right, doctor?
Yeah, the comorbidity must be in between the elderly group, meaning that more than 60 years old. But those who are taking care of the patient in nursing home, definitely we will give them first. Frontliner, 60 years old and above, and also who are taking care of nursing home.
Yeah. Doctor, we have a question from Elaine Teo here. She said, how about the OKU community? Are they considered in the high risk category, and are they entitled for a booster shot?
OKU actually in immunity and OKU is no direct relationship, because OKU community definitely they are healthy as well. It's just that they are just some physical disability, but not necessarily their immune system is weak. Yeah. So in the meanwhile, the OKU communities, I think there is no any special SOP for that yet on this booster dose. I yet to hear any news on this. But so far, the booster dose is for those who the booster dose is for those who have waning off. Actually, everybody will get the booster dose later when you're 60 years old above, when the time of the protection is waning off. So this is a basic concept that I'm going to share with you, not a special group or here. Yeah.
So even if you're below 60 years old and if you have comorbidities, you shouldn't be worrying so much yet, right?
In the meanwhile, not yet, because we want to wait for more data. If let's say we have done all the 60 years old and above group, then the government definitely will consider the younger group, because also stated very clearly in KKM official announcement saying that they will look into the younger group when there's more data on the safety profile.
Doctor, if my parents or anyone in my family, they are 60 years and above, then they are eligible for a booster shot, but they are not so keen getting one. Should I really pester them for it, to go for it, or is it okay to leave them out with the booster shot?
Okay. Just want to highlight the Malaysia policy on the booster dose. Malaysia policy is that it's a volunteer basis, and they will offer you the third dose, and it's up to you to whether you want it or not. But majority of our the safety profile already vetted out, saying that it's safe. So they give back to our community to decide. But however, definitely the policies come out is because we know that there's an increase on the cases, especially in Sarawak, and now catching up with Selangor and also KL. It shows that the vaccine protection is currently starting to wane off. So that's why KKM have come up this type of policy to protect the public. They put this public health issue as a priority for them. That's why they offer this booster dose. I personally, for my parents, I definitely will take the third dose. And I myself is frontliner, already received my third dose anyway. So I'm still okay.
That's good to hear. Yeah, that's good to hear. I just want to go to some of the questions that kind of pointed out to this. Why was the Pfizer vaccine chosen as the booster dose compared to the other vaccines?
Okay. First of all, Malaysia have a lot of doses of Pfizer. Definitely, this is the most convenient answer to you. And we have a lot of Pfizer dose in our country, so that's why we are giving the Pfizer. And also, Pfizer was well tested on a lot of other safety profile. They have a good safety profile. That's why I think they choose Pfizer. Definitely is based on the database that we have. A lot of publication about Pfizer vaccine. So as a choice, the method of choice, definitely you have more stock, and then you have more controllable profile, meaning that you know the whole thing about this, and then you are more confident to use that, right? Definitely, this is the two benefit that's why Pfizer was chosen.
Do you think that we will actually move to a point where maybe other vaccines would be considered as a booster dose as well?
Definitely, yes, because one of the policy have written that I read the policy. Definitely, they say they are considered looking into other possibility of other vaccine when their safety profile is available, and then we look into it and what is the timing that should be used as a booster dose. We were waiting for those data. Definitely, Malaysia is always open to other vaccine to be open for as a booster dose. Definitely, yeah.
We talked about all this waning immunity, right? I think that should be a topic of discussion as well. What are because we were made to, at least in the early implementation period, thinking that 2 doses is enough, or 2 doses will give you a good protection, and then now we're talking about waning immunity. What are the risks that we face especially if you're 60 and above or immunocompromised? We're talking about the risks that come with this waning immunity, and we don't do anything.
Okay, actually the how to say, the publication on the waning of the protections, the evidence is still not very strong for me, as my personal opinion, because there is still a few layers of protections that causing the that protect us from COVID, which is after you have this immunity injection of vaccination, you will have this serologic type of immunity. Maybe that serologic type of vaccination effect will wane off over 6 months, but our memory cell in our body, which is the white cell in the body, which is we call it the T cell, it might remember this, and it will last for many years, which we still yet to wait for this report to come out, you see. But there's some of the reports that are talking about for SARS 2003, the SARS virus called SARS-CoV-1, they found that until more than 15 years, almost 20 years, the patient who have recovered or recovered from SARS-CoV, they have this cellular memory that protect them. So we still yet to explore the cellular type of immunities, whether it can last longer or not. Okay, for the instant, for this cellular, waning off of protection, there is some data as well, a data from few publications as well. So if we wane off and lower than the expected protection rate, the outbreak will come back again, meaning that the COVID outbreak will come back again, and we will like facing the same like we are the first time when we face the COVID, which we will have a increase of hospitalizations, increase of ICU admission, severe disease, even death. So that's why.
And you're saying that even with the, let's say, I mean, immunity is complex, right? The immune system is not something. It's not something that we can just grasp in a day. But you're saying that if there's a chance that with this waning immunity, that we could just be as vulnerable as we are back then without, or actually it might be different.
This is why I say there's few things that are still uncertain, because if let's say the immunity wane off as we predict, assumption. Okay, we make an assumption. If let's say the wane off as like you don't have any immunity anymore, then we will go back to the previous the first time when we start, dealing with COVID. However, if let's say the hypothesis of the cellular immunity means that the cell can remember after you get the vaccine, right? And actually the protection can be longer, then maybe the waning off is not the issue so much. Meaning you still got protection, maybe you can, we will less cases as well. So that's why I'm not very clear. I'm very uncertain about the current, because we don't have enough data on more than 6 months, how the condition is. But from our own Malaysia data, you can see because our Sarawak people have this Sinovac or Pfizer, some of them have quite early. They quite early, and then the effect, according to our KKM, saying that the case is coming up, the hospitalization is coming up, is due to the effect of the vaccine itself. The protection is start to wane off. This is what worried them. That's why the booster dose decision was made on this, and which I think as a professional, I feel this reasonable to look into this. However, maybe we have a different kind of vaccine, have different kind of cellular response. Maybe they will give you a better. We need some more time to understand about the behavior on all type of vaccine. There's too many brands, you see. We can't tell you much. That's why some people say the heterologous type of vaccination will, some sort. Heterologous is a mixing of vaccine. Yeah. They can give you a much more, cover each other disadvantage. This is also something that we are looking into, because AstraZeneca, for example, as the first dose and second dose as Pfizer, they give 8 times of immunity, 7 to 8 times of immunity compared with only AstraZeneca alone. So this is a publication. This is in Sweden, if I'm not mistaken. Yeah. So that's why I mean, there's a lot of uncertainty for me, because this is the first time that we have so much of heterologous, have different type of vaccines that are available. If you say it's hepatitis B, so many years, the same type, so it's predictable.
Mm-hmm. Doctor, speaking about mix and match, we have another question here from Felicia. She asked, will there be implications for 70 years old elderly with health issues being administered with 2 doses of Sinovac previously and now taking Pfizer as booster?
Implication, actually, implication-wise, there is much. For me, as a 70 years old elderly can take 2 doses of Sinovac previously uneventfully, I don't feel that the 3rd dose will be a problem. Because,
and why is that, Dr. Tan?
Because it's already 3 months apart, there is not much of interaction between 2 type of vaccine. And as if I would like to tell you, share with you that a lot of 70 years old elderly taking Pfizer as first dose, in Malaysia, and the second dose in Pfizer in Malaysia. Not much of there's no case of pass away or ICU admission, right? Remember the last 1 year we have Pfizer for elderly. There's no reported cases of that, right? And also nothing much happens, even just a minimal allergic maybe, or they have some bowel palsy, something like that, but it's not a big issue. So there's no any heart attack as I know. So if let's say Sinovac previously you get it and no problem, now Pfizer after 3 months apart, I consider as like a fresh, you are a fresh dose of Pfizer. You treat yourself as receive the first dose of Pfizer as if like you are last time those people who received their first dose.
I think that's something maybe I'm also uncertain about, because from what I'm hearing, you're saying that after a period of time, because some people think, I think some of the fear that's coming out, if I can relate to the people who are watching, is that they think when you have been jabbed with the vaccines stay there for life, and just like poison or anything, you have that perception. The more you jab, you're actually accumulating more of that chemical in your body. But you're talking about no interaction after 3 months or maybe 6 months. Are you saying that in a way that the vaccine is actually not there already by 3 months?
No, I am not saying in that way. I'm saying that I just saying that it might be in that way, but there is also possible that it's like we get the 2 jab and then you get COVID infection now. Yeah. So the symptom will be mild and then less allergic, because those vaccine is already inactivate virus or part of the protein, right? And the dosing is quite low compared with the direct infection from the COVID itself. So when you have the injections of some vaccines, and then after that you get COVID, your symptom is less. The symptom is less. So this I'm not the expert, but I just want to share my opinion on this, because if you get another type of vaccine which is part of the protein as well, only the effect won't be so serious compared with getting a COVID after your 2 jab. This is what I understand. But if the same type of vaccine giving 3 times, 4 times, maybe there will be a different story. I am not very that is not what I feel that I'm still lack of understanding about that, because you see Pfizer, those for younger patients who have our myocarditis. This is something like they triggered an autoimmune problem that make our heart inflame. So this is what I not very clear about that. But implication wise, somehow I just have this very raw statistic, or we call it some of the news from here and there, and also from the KKM, which we have this 1 week plus vaccination in the Sarawak group. There is not much of issue. There's no issues at all. So that's why I'm quite positive about this. Yeah, but I didn't say 100% is safe, but there is a risk. But definitely, I can see from our local example. Yeah.
Yep. And I didn't ask these questions just in a way to like put you on the spot or anything. I just think sometimes I just want to address the concerns about what netizens might be thinking, and I'm really glad that you took the time to also to tell the things where the science right now may be uncertain, and because we cannot, if these things we're still waiting for data as well. And it's also good to realize what our limitations are in terms of this situation now, as we are going through the pandemic, or the endemic as we call it together.
Yeah. But remember, getting a COVID and cause casualty or death, the risk is higher compared with getting a jab who die because of vaccination. There's almost none until now, but some of them say there is 1 or 2 cases, but there is a particular reason that it's not because of vaccine. So from here, I still I'm not advocating for the 3rd dose or not, but I just give you a fact that you can decide by yourself whether there is a risk that you need to take or not on coming offer on third dose. No, sorry, the booster dose. Yeah.
Tina, do you have a question?
Greg here asks why mix 2 doses of Sinovac with Pfizer as third booster shot. Can we choose Sinovac as third booster shot? Currently, we are not given an option, right? Even if you are eligible to get a booster shot, we are not allowed to choose the brand.
I'm not very sure because of what, but I in my opinion is that we don't have enough of Sinovac doses. That's all in the country. That's all. But I think there is an offer later on when the dose is more. I think this is the
possibly
only
we could be waiting for more data as well.
More data,
in terms of the timeline when the
the timeline also we are not very sure.
Yeah.
Yeah.
The other thing, well, I we have a lot of questions that are coming in, but one of the questions that I actually saw is, do I need to test my level of immunity, or is there a way to test my level of immunity before I decide on getting a booster shot?
Okay, this question actually I have discussed with my colleague who are in the serology and microbiologist. I discussed about why we don't test it first, and myself also go and find some answer, because for me immunology is a very deep sea that I need to understand a lot of things, right? So I make it simplified for you. So if you have a type A of vaccine that inject into our body, then they will trigger a group of antibody response. It can be A, B, C, D, E. The name is antibody A, antibodies B and C, whatever so called. And you have different type B of vaccine you put into the body. You might get a E, F, G, H type of antibody, right? In the meanwhile, because this vaccine is still early, okay, definitely our Malaysia here, we are still waiting for, there's still they already identified few antibody, definitely is good enough, but I think still need data to say which the antibody can tell you the exact protection come from which antibody. So there's a different type of antibody going around, and and also there is also mixture with a natural occurred COVID infection, because COVID is we are asymptomatic. Those patients who are asymptomatic also have antibody. So we are not. If you test for the lab, when you want to test for this antibody, there's a long list of antibody you need to test, only can tell you the complete immunity of yourself after the vaccination. I think this is impossible to do it, a whole list of that. Maybe you test A, but actually your B is more. But the A say the A is not enough. They say you're not immune, but actually you're immune. And also there's a second part of the answer is that the cellular response toward the vaccine was not able to test in the lab, not commonly available to be tested. So, and also the third reason is why is because it's very costly. If you want to test everybody, only you give the vaccine, as compared with the vaccine is cheaper than to test it before you give. Definitely, for economic points of views, and also for the policy, is a bit hard to give and take. So definitely the cost is the part of the important factors that why we give vaccine based on without testing, but we based on database. We based on the publication from about good
different
countries, different countries. They give you data already. Then why you want to waste so much money to go ahead and do again? Repeat the whole thing. So these 3 points actually make you not favor to testing the antibody before you get the third jab, or to test yourself whether you're immune or not, because it doesn't reflect whether you're immune or not.
Basically, the main thing about if you want to decide to test is, one, our immune system is so vast and complex that you have to if you really want an accurate picture of whether you're immune or not, you have to go to so many different type of tests, maybe, right?
Yeah, it's crazy, and you have to do everybody for the whole Malaysia.
So what we're basing off right now is just basically collected data that we have from different countries and different group sizes in order to make a I guess the best informed decision.
Correct, and it's a very scientific way of doing a decision. It's not like from expert opinion or what. It's a very database driven scientific evidence. Yeah. So that's why I'm quite quite understand that why people ask these questions, because I, as myself, if I'm not a doctor and I didn't go for journals reading, I definitely will ask these questions. I also want to test myself whether I have protected or not.
Yeah.
But
Mm.
there's a lot of limitations that after that I learn into more this immunology thingy. Oh, this is what more complex than I expected.
So how do we? I think it really comes down to the theme of this video right here, right? So how do we decide about the booster after talking about the limitations that we have in data here, and but also talking about in the sense where there is a risk and benefit that is on the table, and we know that being unprotected with COVID-19 is I think the worst case scenario. But with then also we consider limitations. So how do we decide it's the shot or not? Whether we should
Okay,
take
first
the
of all, definitely you have to see whether you are inside the age group that you have a high risk of getting the COVID death or not. Because I think from our Malaysia statistic, many disease patient, passed away patients, they are in a elderly group. Yeah, even overseas. Yeah, it's 60 years and above, high mortality when get the COVID. All right. So after you get the completed 2 doses of vaccine, actually the risk of getting a COVID death is minimized to maybe 1 or 2%. Yeah, maybe there is 1 or 2% still can pass away because of other things, right? Maybe due to COVID and then complication from all the medicine. All right, that one we not talk about that. I don't know how to talk about so many things. So, but if let's say there is a chance that there's a database, they already published some cases that after 6 months, there's a waning off of the protection. There is already evidence saying that there's a waning off of protection from this vaccine. Then the risk of getting COVID death is starting to climb up again. It's climbing up again. So this is where the junction, whether you want to take the risk of whether you want to go on with the booster dose to stay back the same type of protection that you gain during the 6 months, or you want to give and take and wait for a while and wait for the more data to come in and tell you the safety profile about the booster dose. Only you get the third dose, the booster dose. Or you can also decide that don't want to get the booster dose at all. That is also another choice, you see, because but just want to share with you here is not to promote anything, but I just want to let you know that the for 60 years old and above personnel who get the third dose, the complication is rare and is lower than even the accident rate. This is what I just want to trying to tell you. That's all. Yeah.
Appreciate that. I appreciate that, Dr. Tan. Do you think that we are going? Do you think that right now it's about 60 and above, and people who are immunocompromised, frontliners who are getting the booster dose? Is there a possibility? Of course, this is something. It's more like a prediction that even younger age groups would be taking the vaccine, an additional dose of the vaccine.
This is also a very difficult question, and also I'm very uncertain about the answer because I think the data is less favor in the meanwhile. As recommended by WHO and CDC, they only recommend for 60 years old and above. For the younger generation, we yet to wait for more data from multiple countries. So currently, I couldn't give you the answer. Yeah.
Doctor, when we get our vaccines, some of us will get mild symptoms like feverish, and also some of us have like I have body ache when I took the vaccine. So what happened when you get the booster shot? Do you have any symptoms like that or not at all?
All right. Maybe I can share with you my own experience because I am a group of 60 years old and below and get my third jab, which is the high risk, and because I'm male and as a man, to receive the third dose of is Comirnaty. Before that also I get 2 doses of Pfizer. Now this is my third dose of Pfizer. By right from the publication, from the Israel paper in New England Journal, I have a high risk of getting the the heart inflammation, and I have a high risk of that lah. So, however, I myself I received the third dose on the Monday afternoon, which is about 12 o'clock, 12:30. Until now, it's about 72 hours. I just have a little bit of unwell, like the first time when I received the Pfizer first dose and second dose. It's the same kind of reaction, same kind of some tiredness and also some body ache. Other than that, I have a bit of throat itchiness, something like a sore throat like that, but it's not really sore throat. It's like something warm inside here. That's all. Now I'm
a bit discomfort.
Yeah, my voice a bit of harsh, a bit because of the throat discomfort. But after that, today I'm excellently well and no problem at all. This is my personal experience. There's no any chest pain or joint pain or any like cough, running nose or shortness of breath or even allergic. I personally have an allergic to painkiller. However, I get this third dose, I have no any issues at all for Comirnaty. Pfizer. So I just can share with you. But some people in elderly, even I from my families, I have my parents, when they receive the 2 doses, they have no symptom at all, because when elderly, they have not much of our body response, inflammation response compared with younger people. Okay, heart inflammation is due to our inflammation too much that cause harm to our own cell. Younger patients tend to have this cytokine activities because cytokine storm that can hit on the heart and cause the heart inflame. For the elderly, for 60 years old and above, senior citizen, they are less, aggressive on their immunity. So they are more calm, the storm is a bit like breeze rather than storm, the breeze, and then they just very easily go through this, the dose or because second dose or third dose. So that's why the immunology is like that. The younger you are, the response will be stronger. The elder we are or senior we are, the response will be milder and more smooth. So that's why I see a lot of elderly who have received the second dose. Even now, the third dose, there's not much a problem. Compared with us who are 60 years old and below, we will have this, mild pain here and there, sore here.
I remember when I shared my experience with my parents and also my family. I said that I experienced this, I experienced that, but then they were like, "I'm fine, I'm tired. I didn't get fever at all, and I didn't have body ache." And I'm like, "Half that."
I'm so envy, isn't it? We are so envy about my parents. Jeb, no problem at all. I can sleep well. But
my grandfather came back and then he had no issue as well, and he's already 80 plus. And he's considering as well whether wanting to take the third dose or not. But he was fine. He was fine during his first 2 doses. He came back. He ate chicken rice with me. I was like, wow.
That's why I'm not very concerned. I'm not very worried about the third dose on the 60 and above, and because it's recommended by WHO, that's why I'm very, quite okay with that. And they really look into the data. Now a lot of people worry is because of mixing the vaccine that make the public worried about that. And I think I assure you that our Minister of Health and also the whole team have already looked into this. Even our Tansari have already looked into this data. I think they have made a very, very tough decision, and this is the best decision for the Malaysian. So that's why I'm very glad that we have a very good team in to back up our Malaysia. As you know that we have the best pandemic handling for the whole world. That's named Malaysia is one of it. Yeah.
I do want to say I can understand the viewers and the public. Sometimes bad things do happen, and we can't, because the vaccine is not risk-free. We wish it was, but it's not. And it to be at that moment where you choose to say, because I want to do something right, I think this will protect, and then something happens to you. I might not be going anywhere here, but it's just maybe the empathy that some people have, because I feel that everyone, if we all wanted to do the right thing, all of us would want to do the right thing. It's just that we're scared. Yeah.
Actually, Joshua, you talk the right
Yeah.
situations. Actually, I myself also a human that I have parents as well. I myself as well will worried about all kind of information, even though I'm a doctor, right? When we know more, we will more fear, definitely, compared with those who don't know. Yeah. But I'm assure you that all of the doctors or all of these decision makers, they also consider themselves have family as well. The policy will involve their family as well. That's why I assure you that nobody want to hurt any one of the rakyat, or people's because of the uncertainty, and also because of the playing around with fire, we call it. Yeah, but I don't think we will play about this. This is something very important and very serious matter. That's why, for me, quite hard to tell you that the hard fact is that no vaccine is perfect and no vaccine is 100% safe. So, but to be fair to everybody, also we have to be very frank to you that what is the risk that you're going to face, and the decision is back to you whether you want it or not. But the social responsibility is important because you protect yourself, also you protect your family and the public. So because this is infection disease, this is not like a lifestyle disease like high blood pressure or diabetic, because this is on your own body. If you got high blood pressure, there's nobody, you didn't involve other people's health, understand? But infection disease is very hard. It jeopardizes so many things. In this 1.5 years, I think everybody learned this, social responsibilities, you protect me, I protect you, kita jaga kita. All these things definitely is make a life-changing, experience for everyone, even for the medical healthcare like us. So I really sincerely hope that everybody understand this, that today is not to tell you that, your booster dose is good or bad, to share with you the concern and, we care about you. And we hope that, you get the best decision that for you, to protect your family.
Yeah, and I think sometimes we worry about something because there is a lack of information about certain topics and stuff. And sometimes even if we want to ask, we didn't really know who to ask. I mean, I can't just go straight to Tan Sri, our health DG, and ask them the question to get clarification. So we are hoping so much that with your, with you joining our show today, Doctor, you can share whatever that your knowledge as a doctor, and hopefully people will weigh their decision better that way after getting more information.
That's why we do it. It's our social responsibility as people in the media and the doctor as well. And we're not here to hammer down. We're not here to hammer down on people and say like this is why you should do it or anything. But we're here to give perspective on an age where there's so much information, but so little right information or information that we can assess and give us that perspective on what to do during hard times. Which brings me to the next question. And this is, I guess, a bit of promo for you because, can we ask any Chinese version on this topic? Because my parents don't understand English. Sorry, we are an English newspaper, but there is a but over there. Dr. Tan, you actually do these sessions in English, in Malay, and also in Mandarin, right?
Yeah,
In
definitely.
Chinese?
Yeah, I have my own Facebook page that I ask Dr. Sepp or tanya to Dr. Sepp or even Dr. Sepp is in Mandarin. Most of the videos and also live show is on Mandarin, and I give a lot of share a lot of information, and I can do a lot of Q&A with you about this topic, especially the booster dose. I did our live yesterday, so you can come to my my website Facebook to look into the video again. If any question, you can also private message me. I can always give you answer you as fast as possible. Thank you.
Right, and if anyone is wondering, those who are viewing, anyone who is wondering, Dr. Tan To Leong is an associate professor at the University of Kebangsaan, Malaysia. He is also an emergency physician with Hospital Canselor Tuanku Muhriz. So he's not just any doctor, he's an educator and also a frontliner who has treated ICU patients as well with COVID-19, right, doctor?
Yeah. We are the hospital, COVID hospitals for many quite some time. Until now, we still a bit of hybrid. We cannot. We still treating COVID patient. However, also my expertise in sepsis, which is the severe infections is related to COVID or dengue or any infection disease. I am the expert on here, and also I'm a president of Malaysia Sepsis Alliance. So that's why I'm for this topic, definitely is my bread and butters. Every day I need to deal with it. So I hope that I can share. But remember, I'm still learning together with everybody. Not necessarily what I told you today is 100% correct, and facts can be always changed. I just try my best to share with you whatever I know. And just correct me if anything's wrong, I'm accept to I'm ready to understand that. Yeah, thank you.
Oh, thanks for saying that. And we also want to tell the viewers as well that you can't just have one source, right? You have to always be vigilant and always look for always expand your knowledge, always look for new information, cross-check, verify. Always do your due diligence when it comes to information, especially COVID-19 and the vaccine. Dr. Tan, because you say you did a live session yesterday as well. Any of the questions that came up that you think our audience here should know as well that we haven't really covered yet?
Okay, I think I have to stress again, the booster dose is a voluntary program. Malaysia is still doing this and they submit all this data for research, meaning that they will look into the database and analyze and then give you a bigger picture. So you might not want to inject. If you refuse, you want to reject today's appointment, you are free to do so. There is no any harsh or penalizations. They will always reappointment for you. But however, when you reject, definite priority will give to other first. But if you think that you want to wait for it, it's okay for this also. You want to stay on the fan first, wait for more data, or you want to go for it also, just go for it. I myself, if my parents, I definitely will bring them now to do it, because I myself feeling that I need to do my the best for my parents. This is what I feel. Okay. And also, one more thing is that don't listen to too many, nowadays there's a lot of fake video or old videos from other type of disease. They extrapolate that, saying that this is a third dose that causing a lot of tremors or seizure or something like that.
I think KPJ had to clarify a few days ago also, because there was a viral message that was related to their hospital with third dose as well. That is fake news for everyone's information.
Yeah, correct. So you go to KKM website, especially a reliable source, to get all this, they will tell you this is fake news or not. If not, then you can come to my site here and I will try to find out for you as well. We will try to debunk all these things. Don't listen to, this brand is good, that brand is good. Every brand have their advantage. Don't too rigid about the vaccine type. Any vaccine is protecting you. Don't reject any chances that you get the vaccination.
Yep. Tina, anything else you would like to add?
I think also sometimes a lot of the people, especially in my family group chat, a lot of people like to play doctor themselves, and they like to also tell people to take this medicine, something that they think is good. I understand their intention is well. Like if you believe in something and you want to introduce to someone else as well, and if you think something is not good, you definitely don't want your loved ones to take that as well. But again, like what Doctor has just said, and also what Joshua has just said, we must always verify. I mean, there are a lot of information available these days, but it's important that we, before getting enough information, it's important that we don't play doctor ourselves.
Even got public play doctor with me as well. So I had to, politely tell them that, you are me correct. Let me check first. I don't argue with them. I usually will receive first. Don't argue with any person and cause your family argument because of this type of issues. Try to be calm, to be compassionate with your family members who love you. This is important.
Perhaps a last question, and it's a technical question. Why are for future reference as well, there are some countries that are administering booster doses to younger age groups, knowing that there is an increased risk of heart inflammation. I think the US, they are vaccinating teenagers with Pfizer. Would that be dangerous for these young people?
Okay, this I couldn't really answer to you because each country have their own policy, but I know that Malaysia is not doing so. So I'm glad that I'm in this country. So, uh, and for as for your knowledge, I know that Comirnaty, which is Pfizer, have a really recommend for younger patient. I mean, just less than 12 years old. They are coming to apply for this EOA thingy to approval for younger generation. But in Malaysia, it won't be approved until it's properly studied lah. So that's why you still should need to wait till maybe next year only to know the news. So I'm getting a lot of questions for this. My young child want to go back to school already, but do they have a vaccine for them? I'm worried about that. Just let you know that young child, they are not dangerous when they get COVID. Usually they are like a mouth flu and they just get well faster than us as an adult. So as a mother and parent, definitely you're worried about children have got COVID, but statistically, definitely children with less serious compared with adult, and won't be so so worrisome. Yeah. So now what I need you to understand that if you are adult, you need to get your vaccine now. If you're not yet vaccinated, I hope that you already get through that stage of hesitation, because everybody have vaccinated. There's no much of complication. Just go ahead and do it. Yeah, and you can travel now with your vaccination, right? Yeah.
Again, if anyone has any other questions, you can ask Dr. Sepp on his Facebook page, which comes in Malay, English, and mostly Mandarin sessions as well, in case there are parents out there who do not understand English. Yeah, but man, I thinking about, you've been with us for a couple sessions now, and I feel good about today's conversation. What do you think? I think we covered. Quite a number of topics over here, and thanks for being upfront about some of the things that you're uncertain with and that you don't know. Yeah.
Yeah, I think when this topic came out, I mean, when our government announced that we will be given booster shots, I think there were a lot of questions in our heads as well and also from the people around us. And I am glad as well that today we had a chance to also ask the expert instead of just simply giving
Making
other people
assumptions
answers that we don't know.
Yeah. Thank you for the opportunity to share with the public as well, because also I'm concerned about the public misinformation and make the hurdle for the KKM to carry out this booster dose policy. So I also hope that everybody will clear about this, but we still can stay in touch with to ask me more questions if you want to, to clarify more. Yeah, always welcome.
And a big thank you to the public as well, the netizens and the people who commented.
Thank you so much.
Thank you for giving your questions, and we hope that we're able to provide a better perspective. Now, I do want to remind everyone that this video and this live session is for educational purposes. Do not take it as a doctor or medical advice. If anything at all, it's always best to consult the doctor that you trust. So with that said, if you would like to have any other updates, or you would like to stay tuned or be updated about future live videos, live Q&A videos, you can always follow the Star on the Facebook page, on the other social media sites. And at the end of the day, it is about the risks and the benefits. There is no 100%. There's nothing that's 100% out there in terms of 100% safety and stuff. There will always be risk. We just have to learn how to weigh them and make the best decision. So with that said, thank you very much everyone for watching. I'm Joshua Lim. My colleague here is Tina Loh, and we have Dr. Tan with us. And we are signing off and saying goodbye and have a good night.
Thank you, Doctor. Thank you, everyone. Good night, everyone.
Good night, everyone. Thank you, Joshua and Tina. Thank you, The Star.
See ya. Bye-bye.